Have you ever thought about an organ that works silently day in and day out, only to roar into your awareness with shocking intensity? Tucked away deep in our abdomen, behind the stomach, lies the pancreas. Most of the time, we don't even know it's there. It's a humble, hard-working gland, essential for our daily survival. But when it becomes inflamed, a condition we call pancreatitis, it can cause some of the most severe pain known in medicine. This isn't a simple stomachache. It's a profound internal crisis that demands our immediate attention and respect. The powerful digestive enzymes are created in an inactive, harmless state. Think of them as tiny biological safety scissors with the guards still on. They are only meant to be activated once they have safely traveled out of the pancreas and into the small intestine, where they get the signal to start their work on our food. This elegant safety mechanism is what protects the pancreas and surrounding tissues from being digested themselves. It's a biological fail-safe that is absolutely critical for maintaining harmony within our own bodies. But in pancreatitis, this fundamental safety system breaks down. The story of pancreatitis is the story of this control being lost. For reasons we will explore, those powerful enzymes become activated prematurely while they are still inside the pancreas. The safety guards come off too early. Suddenly, the organ that is supposed to help digest your lunch starts to digest itself. This process, known as autodigestion, is as destructive as it sounds. It triggers a massive inflammatory response, causing swelling tissue damage, excruciating pain. The pancreas, our quiet partner in digestion, becomes its own worst enemy. The central problem in pancreatitis is this process of autodigestion. Imagine a sophisticated chemical factory that produces very strong solvents. Under normal operations, these solvents are securely contained and shipped out, but in pancreatitis, there's an internal leak. The solvents spill across the factory floor, corroding the machinery, melting the walls. This is exactly what happens in the pancreas. Activated enzymes begin breaking down the very cells that made them, causing inflammation, cell death, and intense pain. What triggers this catastrophic failure? Two main culprits, gallstones and alcohol. Gallstones are small, hard deposits in the gallbladder. The pancreas and gallbladder share a common exit duct into the small intestine. A gallstone can travel and get stuck there, like a cork in a bottle. Pancreatic juices back up. Pressure builds, triggering premature activation of powerful enzymes, igniting pancreatitis. Alcohol's effects are more direct and insidious. Chronic heavy drinking is toxic to pancreatic cells. It can make cells release enzymes improperly, and it can thicken pancreatic juices, forming plugs that block tiny ducts. Repeated injury and obstruction set the stage for an acute attack. It's a chemical assault, pushing the organ past its breaking point. Beyond those two gurkwars, other factors can cause pancreatitis. Very high triglycerides in the blood, certain medications, physical trauma to the abdomen, complications from procedures like ERCP, sometimes no cause is found, idiopathic pancreatitis. Regardless of trigger, the final pathway is the same. Enzymes activate too early inside the pancreas, leading to inflammation and damage, a medical emergency that needs immediate, careful management to stop the fire from spreading. The most prominent and unavoidable symptom is pain. This is not a subtle discomfort. Patients often describe a sudden, severe, constant ache starting in the upper middle abdomen just below the breastbone. Classic feature, it often radiates straight through to the back. It's deep and internal, often worse with eating, so patients avoid food. Finding comfort is nearly impossible. Some lean forward, others curl into a fetal position. Nausea and vomiting are extremely common. The abdomen may be tender and bloated. Fever can develop. Heart rate may speed up significantly. In severe cases, fluid can leak from vessels, causing low blood pressure and shock. Nurses assess these signs urgently. They constantly evaluate pain with a standardized scale. They monitor vital signs, heart rate, blood pressure, respiratory rate, temperature. They listen to lung sounds for fluid or spread of inflammation. Continuous assessment is the bedrock of safe care. Lab tests confirm diagnosis and severity. Key tests measure amylase lipase. Enzyme levels often rise more than 3 times normal. Lipase is the more specific marker. Doctors also check white blood cell count. They review dehydration and organ markers. Pancreatinine, all to build a complete picture of the body's response. The cornerstone of treating acute pancreatitis is to give the organ a complete rest, since eating stimulates the pancreas to produce and release more digestive enzymes. The very thing causing the problem, the first step is to stop all food and stop all drink by mouth. This is known as keeping the patient NPO from the Latin nil per os, meaning nothing by mouth. By removing the stimulus, the inflamed pancreas can quiet down and begin healing. This period of bowel rest is fundamental, giving the body a chance to calm the internal storm without adding more fuel. While the gut rests, the body must still be supported. Pancreatitis causes a massive inflammatory response that makes blood vessels leaky. Fluid shifts out of the bloodstream into and around the pancreas and into the abdominal cavity. This can cause severe dehydration and a dangerous drop in blood pressure, potentially starving vital organs of oxygen. To combat this, patients receive large volumes of intravenous fluids. Aggressive fluid resuscitation is critical in the first 24 to 48 hours. It helps maintain blood pressure, supports kidney function, and ensures adequate blood flow to the pancreas for healing. Controlling severe pain is a medical necessity. Uncontrolled pain increases stress on the body, raises the heart rate, and raises the blood pressure, and makes it hard to rest or breathe deeply. Strong pain medications, typically opioids like morphine or hydromorphone, are given intravenously. They may be given around the clock or via a patient-controlled analgesia pump to provide steady relief. Once stabilized, attention turns to the underlying cause. If a gallstone is blocking the common bile duct, an ERCP may be performed. During ERCP, a flexible scope is passed through the mouth down to the small intestine to find and remove the stone. If alcohol caused the pancreatitis, long-term treatment requires complete abstinence. All patients need close monitoring for infection and for other complications as they begin recovery. Even with the best supportive care, severe pancreatitis can lead to serious and sometimes life-threatening complications. The body walls off inflammation and dead tissue, forming a pseudocyst. Many pseudocysts resolve on their own. Large or persistent pseudocysts can cause pain. They can become infected, they can rupture. CT scan large pancreatic pseudocyst. Dead pancreatic tissue can become infected, an abscess. Abscesses usually need drainage. Some need major surgery to remove infected tissue. Treatment also includes powerful IV antibiotics. Severe inflammation can become body-wide, affecting distant organs. One feared complication is ARDS. The lungs become inflamed and fill with fluid. This can cause respiratory failure. Often requires mechanical ventilation in ICU. Kidneys can fail from dehydration and poor blood flow. Acute renal failure may require temporary dialysis. Careful monitoring, breathing, oxygen, urine output is critical. Repeated or smoldering inflammation can lead to chronic pancreatitis. The pancreas becomes permanently scarred and damaged. Scar tissue destroys enzyme-producing cells, difficulty digesting food, chronic pain, malnutrition. It can also destroy insulin cells, causing hard-to-manage diabetes. Managing chronic pancreatitis, pain control, prescription enzyme pills with meals, strict blood sugar management. Listen to your body's urgent signals. Treatment focuses on supportive care. Rest the pancreas. Aggressively replace fluids. Manage pain. Most mild episodes resolve and the pancreas heals. Key takeaways. Recognize severe radiating abdominal pain as a medical emergency. Support the body through the acute phase. Address underlying causes to prevent recurrence. Remain vigilant for complications. Early action protects this quiet yet vital organ. Remember to subscribe and check out the accompanying PowerPoint in the description.